Good morning, folks. It is Monday, May 11th. You're watching Inside the Numbers with the People's Pundit. I am the People's Pundit, Rich Barris. You guys can follow me on Twitter at Peoples_Pundit. And today I'm solo for a little bit. Tim's out traveling. He may pop in a little bit. I'm not sure yet, but we're going to see. But in the end, I'm looking at some of your comments. It is going to be a little bit of a freewheeling day. So I'm glad you like that. But today, basically, we're going to talk about coronavirus in short, because it's going to be like an hour day, maybe an hour and a half, folks. I know you guys, some of you will give me a hard time if it isn't up to that 2-hour mark. But collateral damage and the crisis. That is the topic of today's show. Over the weekend, I totally changed this at the last minute. I wanted to do something else. And then I wanted just a day, maybe 2 days where I could relax and put politics away, but it just like seeps into everything and everywhere I go, right? So I'm going to start this off today by telling you guys what I did over the weekend. All right. And normally I'm a very private guy. I don't like to show pictures, but some of you know, maybe some of you don't, I tweet out on Saturday, gone fishing. And then earlier in the week, I tweet out that I'm going to go on a fishing trip. Okay. This is what I do for a living. I look at numbers for a living. The risk from the coronavirus outdoors, which we're going to talk about again, because apparently I got to, is low. We're moving soon. We're leaving Florida soon, although I'll never really leave Florida. I love it. But we're going to go to North Carolina, and I love to bass fish. I'm a big largemouth bass fisherman. I just haven't had a chance to do it. It's like one election bleeds into the other. One poll bleeds into the other. And I get stuck like, not going outdoors and doing. You can see I'm sunburned. I had to change the background just so my face didn't look so bad. I'm like swollen and sunburned, but it was totally worth it. All right. And usually I'm a private guy. Don't like to share pics. But I want to show you guys some pics. It'll be neat. Also, too, as I'm like letting people know that I'm going out, I'm taking my son fishing, man, gone fishing. I get these people on Twitter telling me I should have your children removed from you. You're going to put them at risk of getting the coronavirus. It's completely ridiculous. This is what we did when we went out on Saturday and did not catch the coronavirus. All right. First of all, I went out, and if some of you are in Florida, I'll tell you exactly who I went out with. I mean, I had what was like the best trip ever. It was my son's first real time going out for largemouth bass fishing. We caught 21 total fish. The smallest largemouth on the boat was like a little over 3.5 pounds, almost 4 pounds. The second smallest was almost 5 pounds. It was like 4 pounds, 14 ounces. And then the rest of the day, we're just dragging monsters into the boat, while everyone else is sitting with a face mask on in fear of catching the coronavirus, or their children in fear. And I'm not laughing or minimizing this, but we're going to go over this soon. I'm going to show you what kind of a day I had as compared to some of these people. Just the fear porn, folks, is out of control. It's just totally out of control. And we're going to talk about Andrew Cuomo. He needs a new straw man to wrestle up. He needs something else to scare people. So this is the focus of today's show. We're going to set the record straight a little bit. Anyway, so getting back to this great fishing trip. So when you're like not taking pictures of 5-pounders anymore because they're becoming routine, you're having a hell of a fishing trip. All right. So I felt bad because I caught the first couple fish, and I'm like, oh man, I gotta get my son something. This was the first something my son got. Look at this monster. It was ginormous. I mean, this thing, and he probably brought it in. I was totally stoked by it. Look at that thing. It's huge. All right. And then he starts just creaming me. All right. So after he gets that one, which is like 7 pounds, 9 ounces or something, he just starts creaming me. All right. So here's my 5-pounder next to his almost 9-pounder. All right. He's just killing me. All right. And this was my monster of the day. All right. So that one was 8 pounds, 14 ounces. I think that was the 8-pound, 14 ouncer. In the end, at the very last minute before we go, he hooks onto a 9-pound, 3-ounce lunker, which just puts me and my monster away. All right. And I'm like, no. But actually, of course, I'm happy. I mean, both myself and the other guy out there, Captain Ken, we're trying to get him this monster fish, like let him, please God, hook on to one more that beats daddy. And he did, and he killed it, and it's like 3 guys on a boat outdoors in the open. And I am bringing this up today. And normally, like, people who know that me know I'm private and I don't like to discuss this, but I forgot how much I missed fishing. And it's like a part of my soul. It's a happy place. I love it that much. I got out of the Army. Fishing was a huge center for me. And my kids have been locked in this house now for months. They missed out on the last end of their school year. And I'm like, the hell with this. I'm going to take them out. And as I mentioned, I'm going out, and these people are on you should have the Florida Department of State take your children away. These people are crazy. First of all, I dare you to try. Second of all, let's look at what the actual data says about whether or not outdoor activities put these kids at risk, because we're moving into the summer now. And we're going to have about a dozen more states are loosening restrictions. But I'm talking to parent after parent wondering, are they going to let my child or my children go to summer camp? Am I going to be able to take my kid fishing? Is this something I'm going to be able to do? Or is this a lost cause? Are these children meant to be locked up all summer long, only to come to the fall season again, the fall school year, and them talking about, maybe we got to do things differently. Maybe we don't go back at all. There is serious discussion out there from people in the Northeast, mostly, Democrat governors. Let's be real about this. Democrat governors who want to turn your life upside down before this election. All right. And let's look, since they worship on the altar of science and data, let's look at what the science and data actually says. All right. I'm going to put up a series of bullet points here, and then I'm going to go through it. And this is like kind of mixed in with my pundit's perspective for the day. Okay. This is a study. All right. Because it's first thing I'm going to talk about here is a study from Southeast University in conjunction with the University of Hong Kong, Tsinghua University, et cetera, right? Anyway, they looked at about 1,245 cases. All right. And if you look at the abstract, which I linked in the YouTube, you guys can follow along if you want. They looked at 1,245 cases in 120 prefectural cities. That's their version of a municipality. All right. In China, they have their provinces, kind of like we have states. And then within their provinces, they have them, which are kind of like townships or municipality, depending on where you live. All right. A city, a township, depending on where you live in the country, it'll be different. Well, that's what China calls them. So it's try to think along those terms. All right. Home outbreaks, and looking at the outbreaks, 318 that they had found looking at these cases, nearly just under, a tenth of a percentage point were home outbreaks. The outbreaks occurred in the home because of living in tight-knit spaces where you're at risk of repeated infections over a prolonged period of time. The second highest category at 34% was transport. Okay, that would be, look at New York City, our main epicenter. They have a below ground, no sunlight, crowded area that is their mass transportation system. So it makes perfect sense why New York, along with how they have chosen to live, it makes perfect sense for why they had the issues that they did. And then we're going to talk more specifically about why New York and New Jersey have the problems they have and how many of those cases can be attributed to those problems. All right. But overall, outdoor infection. And I have people on Twitter telling me, I'm going to call the Florida Department of State. I dare you. I dare you to come try. All right. Come try to take them. All right. Anyway, outdoor infections, 1,245 cases, a single outdoor infection. One. All right. Does somebody want to run the math on that? You want to go to your percentage calculator and type in what is 1%? Of 1,245. One of the things we're going to study when this is over, all right, is how mass fear just gripped what are otherwise healthy, low to almost no risk populations For instance, looking here in my city where I am, college and everything, women under 30 with no comorbidities running around with respirators on their face. And now my city has an order. You got to wear a mask. You want to go in Publix, you want to go to the supermarket, you got to wear a mask. It was a problem the other day for me. It was a problem. First of all, I did hear about it, but there are some exceptions. They don't care about whether or not you have those exceptions. And the fact of the matter is the science, how they're defending themselves are by pointing to the CDC recommendations now. The CDC said something else completely different a month ago. And that's the whole point of today's show. Making decisions, draconian, rash, bold decisions in times of crisis with no or little or inaccurate information. We saw this this is why people return to the crisis in Leviathan, because it works. Everybody, if you were to rewind your time clock, go back to the 2007 to 9 financial crisis. All right. Everybody said we had to pass TARP or else the economy was going to collapse. Everybody said we had to pass the American Recovery Act or else jobs were not going to come back. And Barack Obama put up his little chart, reminds me of the Fauci chart, with and without social mitigation. This is with or without American Reinvestment Act recovery jobs. Later on, only to come to find out that the American Recovery and Reinvestment Act probably cost or delayed about 1 million private sector jobs. That's what the hindsight. Stop panicking, look around, get a grip on your reality, center yourself with whatever stone is your stone and think for a moment and put down the fear porn. That's what the studies later found out. Or the best guess anyway. Could be worse, and then for our trouble, we get Obama to go to the microphone and say maybe those jobs weren't so shovel ready. In this case, it may be even a little worse. Because while the coronavirus is novel, there are other coronaviruses, and we have seen other SARS epidemics and pandemics, right? So we had things to compare it to. So other severe acute respiratory illnesses. There were, this isn't the first one. And not surprisingly, some of the ones, and we've been over the cases with the school closures, review of other studies that found out that it did little to mitigate the spread of SARS. And now we're finding out the same. Why? Children just don't carry that kind of a viral load. They don't infect adults en masse like adults can infect children. So the Petri dish idea that my co-host, has tossed out and advocated himself as the devil's advocate, that's out the window, folks, out the window. This study, it's right there, and it's in quotes, conclusions. All identified outbreaks of 3 or more cases occurred in an indoor environment, which confirms that sharing indoor space is a major SARS-CoV-2 infection risk, which is what causes COVID-19. All right. That gets into when whole indoors versus outdoor risk factor. It gets into these horrible stories that we keep hearing about nursing homes, which we talked about a little bit. The unintended consequences of, maybe it's not a good idea to pack old people in a nursing home with no human contact or activity, regardless of whether or not they have Alzheimer's disease. We are social creatures. We need human interaction. We cannot be isolated or confined. That's why prison is a punishment to social animals. It's a punishment to be locked somewhere. It's not a privilege. All right. We just over the weekend, this kind of stuff. This is the stuff I'm talking. I'm trying to just enjoy myself and fish, but this stuff pisses me off because things could have been different if people would have just taken in some air. And I understand it was a difficult situation, but just breathe. You don't make ahistorical decisions with little to no or inaccurate data. You just don't do it. Over the weekend, Cuomo rescinded his, he said, on March 25th, the New York Department of Public Health followed out his orders, which basically said, and for those of you who don't know, I'll put it up actually. Here it is right here. Here is the order from the New York Department of Health. COVID-19 has been detected in multiple communities throughout New York. There is an urgent need to expand hospital capacity in New York State to be able to meet the demand for patients with COVID-19. I read that part for a reason, because the idea was they were afraid in the end that hospitals would be overwhelmed. Okay. And outside of a few areas, that really didn't happen. So what they wanted to make sure is that these nursing homes took back their elderly and their senior population that was in the hospitals as quickly as possible, because they wanted the beds. They were estimating that there just wouldn't be enough beds. And we saw the president, send a naval ship, the Army Corps of Engineers, the Javits Center, unneeded. Completely were not used. They were empty. Great pictures from our photographer, Lisa, in other areas of the state, just completely empty hospitals who operate on very tiny margins, by the way, despite what you may think, and despite the healthcare executive boogeyman out there. Hospitals, they deal with a lot of debt. They deal with a lot of unpaid bills. They pay workers a lot of money. Let's be real. They don't have the money to sit there with no to low capacity. When you issue an order that says no elective surgeries, you put people out of work, you hurt them, and hospitals were already closing before this happened. This exacerbated that problem. It made it worse. So before he had any real data, he's looking at the doomsday forecasts by people like Ferguson, who has last week resigned in disgrace because he was caught having an extramarital affair, breaking his own rules that he wants everybody else to live by, or having her break them. People like Murray, we talked about last week, a complete fraud. The model is it's not a real model, folks. They didn't have enough data to make a model. It's a fraud. It's a total fraud. In the case of Ferguson, the guy said that millions of people would die from the bird flu. Go do your research. We're talking about hundreds of people. Now, this is a different situation, but my point being, this is what Cuomo took this idea, this view from these people, and this is what was behind the rationale to issue orders like this in New York and New Jersey too. That they thought that the hospital overcapacity would be too much. So they wanted seniors who were infected to return to their nursing homes ASAP, as soon as possible. And what they did was they brought the infections back to the nursing home, where it was just akin to home outbreaks, which is clearly the highest risk of infection, is by repeated indoor sharing of space. Sharing indoor space. And repeated contact with people who are infected. Let's play the imagine if game again, all right? Imagine if Donald Trump issued an executive order that forced infections into nursing homes and thousands of people died. There was just another couple hundred reported in New York on Saturday night, maybe. Kind of snuck it in for the Sunday number, I think, or it was vice versa, Sunday night. But about 207 more reported. They held back this number, which was thousands for a long time, said they really didn't have that number. All right. And then they're telling us, which, whether you can believe it or not, I think it's probably a lot more. But they're saying, a little bit more than 12% of total coronavirus fatalities in the state of New York are nursing home fatalities. He finally rescinded that order from March 25th. But it's too damn late. It's too late. This was a preventable, this could have been completely prevented. All right. This mistake was an avoidable mistake. This was a catastrophe, making a bad choice in a crisis with little to no or inaccurate information. New Jersey's even worse. NewJersey.com thinks that it's probably about half of all the fatalities in the state were in nursing homes. That's a complete and total failure. It's worse than a failure. It really is worse than a failure. These are deaths that really did not have to happen. These were government imposed policies that caused a lot of these deaths. If Donald Trump had done this, if this was a Trump policy, Forget about impeachment. Forget about it. They'd be rolling the guillotine down the street right now. They'd be Adam Schiff and Jerry Nadler would have hammer in hand building the gallows out right outside on Pennsylvania Avenue. They'd be ready to tar and feather and then hang this guy. I mean, in all seriousness, they'd be calling for him to be tried for crimes like against humanity. We've already seen people do that. You think if this was him, there wouldn't be a whole new level of outrage never seen in this country before? But it's Andrew Cuomo, who, by the way, just extended his stay-at-home order to June 7th. The curve was, deaths are a lagging indicator, as we've been through a million times. The state of New York has hit its death peak a month ago. Over a month ago. Can it come back? Sure it can. You know why? Because we're hiding. Because hiding indoors does not get rid of the virus. You could have protected those people more by having the people who work around them are the ones who leave and then come back and bring it in. And that was the center of the conversation and the debate about nursing homes. Well, we're going to lock them in, but they're still going to be the workers who come in and out. But it ended up, it was actually, that's not what did this here. What did this, in large part, was sending back people who were infected to live back in their facilities. It was something that blindsided. This was a blindside to them anyway. To those of us who were critical of this policy, it wasn't. But this blindsided them. It wasn't even a question during the debate about whether or not we should do this in nursing homes. That was not a question. The question was the people who work there going in and out, leaving their jobs for their shift, going home, interacting with others, being asymptomatic, and bringing it back. And then there were conversations like we brought up yesterday that I was Friday that I was having with the former ambassador to Israel for Canada. And her mom is stuck in a nursing home. We're worried about unintended consequences. I know tons of people like that down here. Ron DeSantis did things very differently. We don't have the problems that New York and New Jersey had. He simply did not impose these strict blanket one-size-fits-all policies. He didn't. And things ended up differently. And I got to give it to him. He's one of the few who did not make these bold, ahistorical decisions without any real data to back it up. And the big platitude is you're going to follow the science. Got to follow the data. Nobody's following it. They didn't follow it to begin with. Now we're here. Then this wasn't an unintended. We knew this would happen. Last week, jobs report. Oh, and this isn't something else that bothered me over the weekend. We did talk. We always give you the forecast range. It's the low end. It's the high end. It didn't come in as bad as some people thought. It's still there's still 32 million. We crunched it over the weekend. We're confident enough to say it's at least 32 million. And it could be more. It really could be more. It's hard because, people did get it temporarily. Maybe their employers got PPP, the Paycheck Protection Program. They got the loans for PPP, and now they're back. So it's hard. So it's not really, you can't just take the numbers that the Labor Department and the Bureau of Labor Statistics put out for you, and you can't take that with you have to take it with the rest of the lagging data that comes out, and then you'll get a better sense of who may have gone back to work and who didn't. I told everybody on this show, everywhere else, that if you give people the opportunity to sit on their butts, they will. And we're seeing that, unfortunately. People are going to collect their benefits until that time runs out. Some of that is the provision we spoke about. I explained about now too many times to repeat that in some states they will end up making more than they did at work. So they'll stay home. But that's not all that's happening here. Some of this is that people are just afraid to go back to work. They don't feel that the risk, even though they may be in a group of people where the risk to infection is so low that it's really, you really can't There's almost no difference. Oh my God, the dreaded comparison to the flu, but there are other diseases that we live with every year. We don't cower in fear and not go to work because of these other diseases. If you have a comorbidity, that's a totally different story. If you are someone who is at risk in some vulnerable category, totally different story. But we're beyond that. We've been pushed far beyond that now. We have healthy people who are at very low risk, terrified, and not wanting to go back to work. It's going to take some time before that goes away. It's going to. It took time to amp that fear up. In the beginning, people were wondering, well, the media and the government just kind of, overhyping this, to use Professor Murray's comparison to a hurricane. Are they overhyping this? Like sometimes they overhype a storm. And then eventually that turned. I mean, it's just like one thing. You have to look at Cuomo this morning. Look at this guy out here this morning. They have nothing else. Oh, that's Alex, right? So this is Alex Berenson, he former New York Times guy, has a book out. The reason why this went up is because it's in response to the stories. The New York Times jumps on this. Cuomo says that there's, that they're investigating 80 some odd cases, or 73 now in this story, but I think they're up to 80 or 83. It says 73 here, but it's this new mysterious illness that may or may not be connected to the coronavirus that threatens children. And he says here, millions of children worldwide have already been exposed to SARS-CoV-2, which is what causes coronavirus. Hospitalizations and deaths are vanishingly low. Yet suddenly, just as the media and the lockdown governors need a new reason to panic people, New York State reports 3 deaths related to COVID. And then if you go on this thread, he gets more specific. What does related mean? Related how? Who knows this? What do they know? Some of the kids and others who were hospitalized but fortunately didn't die had an active infection. Some had antibodies. Some had neither. Did they have other serious medical conditions, other comorbidities? Nobody's saying this. Nobody's giving you this information. There is a plausible or even implausible mechanism of action here, he says. Your guess is as good as New York Governor Cuomo's. No matter, this is all an excuse anybody needs to keep campuses or summer camps closed all summer, and maybe even schools in the fall. Wait for it. He's absolutely right. They are absolutely going to keep this going. Absolutely. And if you think this isn't going to be used as an excuse to do this election differently, you're nuts. I don't want to talk about the electoral stuff here too much, but it's like you can't separate it. You really can't, because it all factors into their thinking. It's all factors into their mindset. It really does. They wanted to slice Trump's Achilles heel, which is the economy. The coronavirus gave them the opportunity to do that. And when I criticize him, by the way, what I mean by, yes, I know the governors shut down their economies. Donald Trump did not shut down the economies. But what he did do is let Dr. Deborah Birx and Dr. Anthony Fauci provide them cover to do so. So when the federal government, the National Institute of Health, the Centers for Disease Control are all saying, this is what we recommend you do, you provide them cover. You think that New York Governor Cuomo could have shut down the financial district without some kind of cover? No way. No way. And if you think that, you're deluding yourself. You're deluding yourself. The federal government gave these governors the opportunity to hurt the economy, and they're going to prolong it as long as they see fit. The death count is in New York, which it represents a large chunk. It was 42 or something last time I looked. But a large chunk of total U.S. fatalities. A very specific situation in New York. Even they're over that. Death is a lagging indicator. The peak of deaths for New York was around early April. It's over a month ago, and he's extending it. So, I mean, I just don't know, like, how much more I can tolerate some of these people saying, oh, you're just Mr. Doomsday. At some point, you're Mr. Head up your butt, all right? You're Mr. Head in the sand, whatever nice way I could try to say it. If you don't see what's going on here at this point, you don't want to see. And you're either A, just a sycophant who wants to believe the president, or B, you're a hater who wants him to fail. Those are the two classes of people at this point. There's really, of course, they're going to do this. Of course, they were going to do this. And back to the economic impact. So it's around 32 million. We can safely say that. Although if you watched, I was on American Countdown with Robert Barnes last week. If you watched that, he's got a good point. It could be more. I'm being conservative here, with my estimates. I don't want to go off down a rabbit hole. I'm trying, this is what I can tell you. I feel comfortable saying there are 32 million people who are out of work because of this right now. And it's probably worse. Again, you guys know, you watch every Thursday, you read PPD. It's a lagging indicator. So in truth, by next Thursday, this is probably going to be higher. Unemployment will rise higher than the 14.7% that was reported last week. That was a better number. The consensus was about 2% higher. That was a better number. And a lot of people will remain on unemployment benefits until July. I know people who are arguing with me over this, who want the economy to snap back. They feel it will, but they themselves are doing this. It's human nature, folks. A lot of this is human nature. But they scared the hell out of people. They're not going to go back to work until they feel 100% confident that they can, even though they may or may not have a comorbidity. They may be at risk or not. They're not going to go back right away. That's not going to happen. And then you have, of course, some of those who just are making more, collecting unemployment than they would be if they would go back to work. I was on Friday. Who wanted to cook? We had to wake up early, like 4:30 in the morning, to get on that boat and go fishing, right? So on Friday, I go to one of the pizzerias. And I'm like, nobody's cooking tonight. We're just going to have some pizza. I'm sitting in line and I'm listening to these two people talk. One of them was complaining about how long PPP was taking to come through for her, which is totally valid. And then the gentleman that she was talking with, was talking about his specific situation with PPP and that it took his employer a long time. He got on unemployment. Now the employer came back to him just that week. This was Friday, so it was some point during the week. And he said, all right, we can pay you now. You can have your job back. He didn't take it back. Why? He told her, I had been working pretty hard before this happened. I mean, he didn't look like a bum, a slouch. He just looked like a regular working guy. He sees an opportunity to take a break until July. He's going to take it. That's it. So when Republicans let Democrats put that provision in, they all but assured that there would not be the numbers that people are hoping for until at least middle to late summer. I'm not trying to be Johnny Raincloud here, folks. I'm trying to point out to you at some point, you can disagree with what I'm trying to tell you is going to happen, but it's been weeks and weeks and weeks. It seems like the dominoes just have all fallen. At some point, you have your head in the sand. And it kind of reminds me of like people who thought like Robert Mueller was really out to like help Donald Trump. This is like it's a very similar phenomenon. And at this point, I'm having a hard time understanding how you can reconcile this anymore. Of course, it will bounce back. The U.S. economy, I'm an optimist. I am, but I'm also a realist. Of course, the U.S. economy is going to bounce back. That's what it does. Unless Joe Biden's elected. And I'm sorry if you support Joe Biden, but I mean, the economy will not come back as fast under Joe Biden as it will if it was Donald Trump. I mean, again, at this point, that's another one of those arguments where you could look at the Obama recovery, you could look at the Trump recovery. Obama's first quarters of gross domestic product were largely throwaway quarters. Several of them were negative. They were always weak. Donald Trump just got his first negative quarter because of unusual circumstances, with the media constantly pounding for a recession. In the end, Americans are resilient. American consumers are resilient and smart. American business owners are resilient. American innovators are resilient. And they just didn't listen to it. When given the opportunity to be creative and free and put that ingenuity to use, they'll do it. And that's really just that's the secret sauce in this country for a good economy. The Obama-Biden administration hindered that. Their declining unemployment rates were methodological gimmicks. It will not come back as fast under Joe Biden. That is an objective statement. That is not, a partisan statement. That is an objective statement. The evidence is overwhelming. There were bad historical firsts under Barack Obama and Joe Biden. It was the first historically weak recovery after a really big recession. And usually the deeper the recession, the stronger the bounce back. There is a much, much better chance of a big bounce back under Donald Trump if he is reelected than there will be under Joe Biden. And when by the turn of July and August, by that period is when, which may politically work out good for Donald Trump, because that's the period where I would start to expect to see some bounce backs. But GDP is going to be ugly. It's going to be, forget about the Depression. It says up there, Great Depression bad. Forget about the Great Depression. This will be bad. All right. And if past its prologue, as long as you let America do it, they'll bounce back even quicker. But Joe Biden just said we should use this crisis to reshape our energy industry. Donald Trump is saying, let's use this crisis to reshape our supply lines. The supply lines is a much smarter way to go. Now would not be the time. With Brent crude, the futures in Brent crude were about $30. Now would not be the time to mess with the number one source of energy consumption. Now would not be the appropriate or smart time to do so. I'm trying to keep up with you guys on, let me do my little spiel, and then I'll go and I'll read some comments. But yeah, look, I'm not trying to be Johnny Raincloud with you folks here today. I'm simply this is like a prepare kind of thing, because it will be. And I think people are just going to have to suck that up. If you supported the shutdown in the beginning, if you supported these lockdowns in the beginning, you have to face this data that comes out every day. You were wrong. I'm sorry. You were wrong. And now it's time to take your head out of your butt, because people are hurting. I'm not saying you're responsible, but maybe some of you were just a little bit too eager to hate the president and you wanted to see it. And then some of you were just too eager to please the president and you just wanted to be his defender and on his side. You were wrong. And you're just going to have to live with that now and move on. And for those of you who want to hide in your house, continue to hide in your house. But don't tell me whether or not I can take my kid on a fishing trip. He's at very low risk. Children are at very low risk. If the adults on the boat don't have the coronavirus, he's not getting the coronavirus. And kids, the viral loads are too low for the millionth time for them to give or infect adults en masse. And until you show me data, I'm not talking about some crazy, out of the trend study where maybe this one did this and maybe that one did that. Don't show me pure fear porn headlines from the New York Times about Andrew Cuomo investigating 80 something cases of some mysterious disease that they have no clue whether or not it's attached to the coronavirus or not. Don't show me crap like that. Stick to official burden estimates and actual real studies, please. All right. It is fear porn headlines are not sufficient responses to burden estimates. All right. They're just not. All right. So let's do our little spiel. Again, hello to everybody who joined during this. It is Monday, May 11th. You are watching Inside the Numbers with the People's Pundit. I am the People's Pundit. This episode is Collateral Damage in the Crisis. And if you don't already follow me on Twitter, you can follow along at Peoples_Pundit. As you can definitely hear, my throat is a little sore. It's from screaming over those fish, man. It was just a great time. I mean, a great once in a lifetime trip, really. And thank the Lord for the blessing taking, for my son and I to have such a great time. But you're screaming, you're watching your son reel in this like monster, and you're screaming and rooting for him. You lose your voice, you get sunburn. All right. But yeah, so if you guys aren't also subscribing on YouTube, I saw that little jump. I wasn't even doing anything over the weekend. That was nice. Keep it up, and we'll get to that goal. But if you are watching on YouTube and you haven't subscribed, don't forget to subscribe before the end of today's show and give us those thumbs up. Don't forget to like the episode. Also, Facebook Live users, if you are watching on Facebook Live, don't forget to like the page People's Pundit Daily. And then for both of you, if you do one or the other or both, it will notify you when we're going on. This way you don't have to spaz and race to try to get to the show when it goes live. All right. Tim is traveling today. I'll let him decide whether or not he wants to tell you what he's got going on. But he had some traveling, and I was peeking to see. He did say maybe he could try in the second half to get there, but I don't know if he's going to be able to do so. I'll take a second, send him the info. If he can, he can. If not, then then it is what it is. But we'll see him again tomorrow probably. Also, of course, the ultimate way to support the show is to subscribe to People's Pundit Daily. You can do that by going to peoplespunditdaily.com and subscribing, one of our digital subscriptions, or you could just take the short link, which is ppdnews.us/subscribe. Some of you guys, you don't want to make a commitment, especially in this economy. I get it. There are credit subscriptions. So let's say you go there and you're, wow, I really want to see this chart. What's the historical data on this chart? Or you want to click on another article that may or may not be related, then you could just get credit tiers too. So you're not actually making a commitment. You're just putting it up. I'll get you guys that YouTube link. Look, on Periscope, everybody's home. It's this lockdown thing, so they don't, they're not great. You know what I mean? It's just really, I don't know what to tell everybody. It's lagging. So all I could do is give you guys that YouTube. It never gives anybody a problem on YouTube. So go ahead and grab it there. But yeah, I guess, I'm looking at some of the comments. I don't know. I don't really bug them. So if they don't, it is what it is. It's a free service, Periscope. So everybody home, everybody's trying to use it. We use YouTube to actually stream to PPD. And you can always, if you're ever in a problem with any of them, you can always just go on PPD and the, like the video article for the show is always up there. We'll use YouTube for that. We were using PPD's own we have the video service that we use that you see other videos on, but YouTube was quicker. It looked better. So we just moved over to it, but yeah, I know people love Periscope because they can do it on their phone and they can kind of like multitask with it. I know, believe me, I get it. I just, I hear too much about how much it glitches. So maybe there's something we can do about it. Maybe there isn't, but it is what it is. I just want to throw this in people's faces because, this moved quick. I spent a lot of time on that. And it was only supposed to be like 15, 20 minutes because I did want to bring up some other stuff. But I was thinking it's just going to be, let's say it's a 1 hour show of Boots Against Noon. That was quick. That blew fast. I'm going to have to make sure that everything is in there for 10. I actually thought this wasn't going to happen, but it did. All right. Brian Kemp took a lot of crap for putting loosening his restrictions before everybody else. The truth is, there were about 30 governors nationwide weeks and weeks ago, before Trump came out with his 3-phase program, all right, to reopening America again, whatever he called it. The 3-phase program that we went over on the show, that we put up on PPD to read, that we scooped and didn't even know we were scooping. Before that, there were about 30 governors who were, the president holds these press conferences. These conference calls, and they're all on there, or anybody wants to join. Interestingly, Cuomo missed a couple. All right. But there were about 30 that were like, we want to reopen. Give us the green light, do something, put together the way you gave the other governors cover to close, give us cover to open. And so that's why they came out with the phase 3. Anyway, 30 governors dwindled down to nobody, a bunch of little cowards, most of them anyway, a bunch of little cowards waiting to see who would do the rope swing first, right? So, right, remember when you were a kid, maybe you guys set up during the summer a rope swing off the cliff into the lake or a river, whatever you guys had over there. You know, maybe that's just me, but we were kind of crazy like that. And you're all standing around waiting to see who's going to get on the swing first. So after all that work and all that talk, you're all crap talking. Nobody wants to jump on the rope first. Nobody wants to do it. And then there's always this crazy kid who's willing to take the risk like me, you know, and get on the rope and swing in there. They wanted to move as fast as Kemp wanted to move. They just didn't have the political courage to do it. And maybe I'll name a couple, but about 5, you know. But in the end, Kemp did it, and he took a lot of crap, and he even took crap from Donald Trump. They asked him about it during the one of the daily press briefings, and he said, you know, I talked to him, I told him, I gave him, you know, I expressed my dissatisfaction, but I'm not going to tell him not to. So, of course, the president privately was rooting for him to reopen the state of Georgia. He just didn't want to say it publicly. Some of the stuff that bothers me with Donald Trump, just say what you want to say. Don't let them pin Kemp into a corner when you know what he's doing is correct. So anyway, here's Kemp's little throw in the face the other day. All right. You got Cuomo saying that he's going to extend his restrictions until June 7th, even though I don't know what data he's listening to. We got to follow the data. We got to follow the science. Well, the data says you're over the hump. You've been over the hump a month. So what are you doing? Anyway, if you really wanted to do something differently, maybe he'd reform how dank his mass transportation system is. All right. But anyway, here we go. So Kemp takes a little victory lap and he says, this was 2 days ago when I was fishing. He says, today marks the lowest number of COVID-19 positive patients currently hospitalized statewide, 1,203, since hospitals began reporting this data on April 8th. Today also marks the lowest total of ventilators in use, 897, with 1,045 available. We'll win this fight together. And then he's got the mask on there. What he's saying in this pic is, and you know what, let me put it up. You don't need to see my mug. He's sitting there with members of, I believe that's the National Guard. All right. And they all got the masks on, but he is one of the more aggressive governors when it comes to loosening restrictions. So what he's saying there is, we can do this smart and safely. We can do this without making, without this becoming a serious problem. There's a middle ground here, is my point. There's a middle ground. It never was a choice between destroy the economy and shut everything down and kill people, or destroy the economy because we don't want to kill people. We have to shut everything down and we can't move until there's a vaccine or until there's a treatment or a cure. A lot of people throw this word cure at me on Twitter and on other social media. It's a virus. Read a book. There are no cures to viruses as you know them. Viruses are treated. It's not a bacteria. Can't prescribe you Keflex because you got some kind of skin rash. It's a virus. Viruses, we still don't have a vaccine for AIDS. It took 5 years to develop a vaccine for Ebola. But that was one end of the spectrum. And then the other spectrum, of course, that the media used to frame. This is the dichotomy here. You're either for this crazy ahistorical shutdown that's going to destroy the economy because, let's face it, only good people are, or you hate people, particularly old people and people with comorbidities, and you care about money more than you care about life, and what a hypocrite you are. You want to reopen everything all at once, blah, 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 get back to it. This is crap. There was always a middle ground. Always a middle ground. And while, conservatives, like the traditional conservatives out there, were complaining about people like me who said, if you really want to do something, use the Defense Production Act a lot. And I'm not talking about the fake arbitrary needs of New York that they don't even know what the hell they're talking about. I'm talking about to meet the needs of a workforce, to be responsible, to work during pandemics, to meet the needs of our school systems, because we cannot allow our children to be left behind every time China unleashes a deadly new pathogen on the world. Because guess what? This will happen again. It's not the first time it happened. It will happen again, regardless of whether the UK denies the Huawei deal or whether or not we get harder with them with trade. It will happen again. We have built a world where it's very easy for pandemics to make their way around populations in different nation states. That's globalization. That's what we've done. Can it happen without it? Of course. But would it be as bad as it is now or as quickly as it is now? Absolutely not. Because China would not have been able to use the WHO as a mouthpiece to push and spout their BS propaganda for 2 months while people were being infected with this virus. That would not have happened. They would not have been tweeting out on January 14th that the data still suggests human-to-human transmission is not proven. And in fact, as late as January 20th, they made public statements to that effect. Johns Hopkins already knew that there was human-to-human transmission. But that's the danger of worshiping on the altar of science and data, where you cherry pick which ones you like and which ones you don't. The left and the media at large, the elite class, the global elite class, they love the WHO. They love them. They're as credible as it gets to people like that. They do God's work. They do great work. What would we do without the WHO? Same thing we did before there was a WHO. It's like these people have these incredible, arrogant, the hubris is unbelievable. You think there wasn't a world before there was your organization? We always think we're the first ones to have this happen to us, like we're special or something. Think our founders didn't know what disease was? Pandemics? Pox, folks, smallpox. And yet still, we spent 250 years as a country before we ever did anything like this. And we were all just supposed to toe the line. I think it's just really incredible. I'm going to look and see if we got some questions here, because it was fast. It was a fast show. Tim will be back tomorrow, I'm sure. I have no doubt. Let's do, actually, before I run to your questions, let's take a real quick look at the markets today. Okay. So, and interestingly, on Friday, the market shrugged that jobs report off, which was kind of interesting. But most of the markets, except for the Nasdaq, which is still slightly positive, they're in and out of positive and negative territory today. So the Dow Jones currently right now is about a 0.5 percentage point down, about 160 points or so. The S&P 500 is about 0.25% down, but still sitting at the 29-22 level, even though it's lost about 7 or nearly 8 points now. Those are the resistance levels anyway. So if we're going to still be trading on technicals, which will end, I do believe will end. Look, the Nasdaq and the Dow are bouncing in and out. And let me keep going through. The Nasdaq about little under 0.5 percentage down. The Russell, more volatile index, smaller stocks, smaller companies, a lot more upside potential, but also downside risk. That's down by they have the deepest, they're in the red the deepest today at 1.4%, or about 18 points. Tim and I have said a lot that stocks are trading on technicals right now and information and headlines about the virus. If this continues, or I'll let Tim speak for himself. This is my point of view. If this continues and you have these states like California and New York, huge chunks of GDP, folks, all right, if they can do a lot of damage to gross domestic product on their own. If they continue to do that, to continue to extend these lockdowns, markets eventually, without real demand. And by the way, oil, about $30. It may even be down even more now. It was $30 the last time I was looking at Brent crude. If this supply does not get tapped soon, and it's not just like this for oil, it's like this for other areas. You have food, you have a demand issue and a supply issue. All right, you can't keep up with the demand, and the supply chains are near broken. And then you have oil where there's just too much supply and no demand. there is a lot. Trump is right. There's a lot of pent up demand. But if we don't start to use it soon, then it's going to be a problem even for the markets, which is not the real economy. And it's easy to want to tout the markets. They made a stunning comeback since the lows in March, a stunning comeback, but they're not the real economy. And if the real economy does not pick up, and if demand does not come back soon, the markets are going to start reflecting that reality. So we won't even have green days to look forward to the way we have been recently. I'm not shocked the Russell is all over the place. Like I said, very much more volatile index, smaller stocks. The Dow is what they call the blue chip stock, a blue chip index. They have nice, stocks that are still considered growth, but more like growth in income. They don't really move or you wouldn't expect them to. They pay a dividend. They're for nice, safe equity investments, or safer. I don't want to get caught here. Safer. And then you have the Nasdaq, which is a bit more growth, and the Russell is more volatile. So you can make a lot more money. There's upside potential, but you can also lose a lot more money. I don't want to get in the habit of going back to being a financial advisor. I'm not doing that here. But that's what the point I'm trying to make is I'm not shocked the Russell is down, farther than the rest. It's down about twice or almost over twice the dip right now that we're seeing with the Dow. It's farther, six times the dip as the S&P, and the Nasdaq is up. It's remaining up at about a half a point. A lot more trading to do in the day, folks. We've got more than 4 hours of trading left. This show always ends right smack in the middle of the day, but it's cool. We get the morning moves. We see who the movers and the shakers are. We see where the volume is, or at least for that time during the day, where it looks like it's going to go. And then later in the day, though, it's the downside of being 10 to 12. We miss that last 2 hours of trading where a lot can be done. Let's see. Let's look at some. That's a good question. Didn't Trump have to approve the declarations to get federal relief money? Are you talking about like a FEMA declaration? I'm not sure. Clarify that and I'll answer it. But the hospital money and for states, the budgets, that was all approved in the coronavirus relief bill, which is sold to us as a $2 trillion bill. The day it was passed, it was 2.2. And now somehow it's floated up to 2.4. That's without the re-upping. We're going to get Nancy Pelosi shortly, even though she hasn't called people back. Shortly, she's going to propose another coronavirus relief bill, which will be the start of, this is just what we hear, universal basic income, a temporary UBI. So every American's going to get $2,000 a month. That's one of the ideas they're floating in this bill. And we will get some version of this until the end of this crisis, or that's what they say, but it's actually several months. I think it's 60 or 90 days. I don't know which argument's winning out here, but it's 60 or 90 days until after the pandemic is declared over. And we don't even know. This is a great example of the theme of this show. We don't even know if this pandemic's ever going to be over. The coronavirus could be something we live with every year seasonally. So it will maybe never be over. I mean, it's just, again, one of those situations where we're making these big changes to public policy in an ahistorical event with little to no or inaccurate information. And it's crazy. We blew through this show, this hour. Listen, we'll be back tomorrow. Like I said, Tim will be back. We'll be back for 2 hours regardless tomorrow. All right, because there's a lot to talk about that I couldn't get to today. But because we started at 11, it is what it is. And we'll be talking a lot more tomorrow about stuff that it'll be prescient tomorrow still. So, but I want to pack it in tomorrow's show. So we're 2 hours, folks. We're 2 hours. 10 a.m. All right. Anyway, Before you go, don't forget to subscribe to the page, to the YouTube channel if you haven't already. And don't forget to like People's Pundit Daily on Facebook if you haven't already. It will notify you when we go live before we do, so you don't have to scramble to get there. The ultimate way to support the show, of course, is to subscribe to People's Pundit Daily. And you can do that by going to ppdnews.us/subscribe. Listen, folks, all the best. We'll be back more tomorrow. I hope you enjoyed Monday as like a freewheeling Friday thing. And we'll talk more about what's going on with Obama's knowledge of the Spygate scandal, whatever you want to call it. And we'll also talk more. This was a dead economic calendar day. Tomorrow we'll have some more of that. And we'll wrap up the tracking poll, which was still a little bit in. I wanted to get Mondays in there. We'll have all of that, plus more, of course. So again, it was Monday, May 11th. You're watching Inside the Numbers with the People's Pundit. I am the People's Pundit, Rich Barris. Follow me on Twitter if you don't already, at Peoples_Pundit. And I'll see you back here tomorrow, Tuesday at 10 a.m. Eastern Standard Time. All the best, folks. All the best.